Being involved in an auto accident, you and your family were lucky to escape without injury. But did you really? Many people experience pain or complications months later, when the accident is just a faded memory. Chiropractic care can help and is covered by your auto insurance policy if you are involved in an accident. Don't wait. Make the call. Shillington Chiropractic Associates, 610-775-X-Ray.
Chiropractic Better Health Naturally on BCTV is supported by Shillington Chiropractic Associates.
Good evening and welcome to our continuing show called Chiropractic Better Health Naturally. Welcome to summer. We're just past Memorial Day weekend and the weather is getting nice and hot. Tonight we have a couple of different topics that we'd like to talk about. The program is a half an hour long, and you can call us here at the studio. The number is 610-378-0426. I can read that without my glasses. This program tonight is, we're going to talk about pain. Patients always come into us and say, why does it hurt? Or why does it hurt now? And we're going to go over that. We brought some posters along and a spine along. We just want to give you a couple of little updates about what's happening politically right now. This is the second phase of the Obamacare revolution. And I don't know if you've heard today on the news, but there has been a constitutional challenge. Well, it really wasn't a constitutional challenge to the immigration system that's going on right now. And there is another challenge to Obamacare. Obamacare has kind of gotten off the land, so to speak. It's flown kind of like Howard Hughes's spruce goose for a few feet, for a few miles, but it unfortunately doesn't look like it's going to go too far. And here's why. There's a number of different challenges that are going on, but the next phase of Obamacare is the corporate health care plans are due to be canceled. Just like a year ago, the private Blue Cross and Blue Shield plans were canceled, so too now everybody's supposed to jump on board with Obamacare. But there's a little tiny problem. Besides the fact that their website doesn't work and the average deductible is $6,400 for a family in the bronze healthcare plan. Remember, there's bronze, silver, gold, and platinum. Those are the 4 Obama healthcare plans. And you got to cough up $6,500 or $6,400 before they do anything, before 80% will kick in. In other words, before they'll pay for 80% of your care. Besides all of that, and besides the fact that we were told you get to keep your doctor, you're going to save $1,500 and so on and so forth. There's been many different things that haven't fallen through. But the next shoe that's supposed to drop is the corporate health care plans are going to be canceled. So stay tuned for that. The other area of old business that we just need to take care of quickly is the vaccine problem. Many people have been aware and know of the heightened sensitivity in this population to autism. Autism is now at 400%. And there is no natural disease that occurs all by itself that gets that high. It has to be artificially promoted. So the other thing that hasn't really hit the research waves is in 1978, the pharmaceutical manufacturers started using the lung tissue from fetuses to make the vaccines. And ever since they've started doing it that way, there has been a number of different side effects, especially with the measles, mumps, and rubella vaccine. The other thing that people don't often understand is that in this country, you cannot sue the pharmaceutical manufacturer if you get the measles, mumps, and rubella shot for your child and you develop autism or the child is autistic the rest of their life. There's a special provision that the federal government has entered in with the pharmaceutical companies that allows them to do this. They actually call it vaccine court, and the building where they try these cases, incidentally, is adjacent to the White House in Washington, D.C. So if you want any more information about those things, please give us a call at the office. We'd be happy to tell you where you can find that information. But now we want to talk about the nervous system. And patients inevitably come into us and they say, They come in, their neck is in spasm, their back is in spasm, they're getting tingling and numbness in their hands, in their legs, shooting, sharp, stabbing pains, the whole gambit of things and symptoms that happen. And they say to us, inevitably, when we take an x-ray or we explain to them what's going on, they say, why does it hurt so bad, and why does it hurt now? And the first thing we want to say to you is, doctors of chiropractic since 1895, when the profession started, shortly thereafter, 5 years after, x-ray was invented by Konrad Roentgen, or tamed at least. Edison had used it for a while, but he didn't have good results with it because they didn't understand that there are side effects from everything, from taking a picture like the spine that we brought with us here. We take a picture, an x-ray of the spine, and it's very important that you see that. As a matter of fact, just a little aside, when your medical doctor orders, when your medical doctor orders a x-ray, a family physician, you go to the hospital, let's say, and they fulfill the doctor's prescription, and then they give you a piece of paper. The radiologist reads the x-ray, and they send a piece of paper back to you, and that piece of paper is what they interpret. Well, let me put it this way. A picture is worth 1,000 words. This is what Leonardo da Vinci said. And when doctors of chiropractic take an x-ray, we not only are allowed to by law, because we have taken the extra hours over a medical doctor to have proficiency in an x-ray, but the x-rays, the MRIs, the CAT scans, you need to see those, because this is an explanation of the form of your body. And the form of your body, especially the spine that we brought along here, is an indication of the function of your body. And we'll explain this real simple. If you took every cell in your body and you got rid of all the bones, all the muscles, all the tissue, and the only thing that was left was the nervous system, you would still recognize everybody around you as the individual they are, because there's a nerve fiber into every cell in your body. Your nervous system is the master control system of your body. Your brain is like a 40-watt light bulb. It produces the electricity. It has to travel down the spinal cord. We're going to show you a couple of pictures here, this poster over my left shoulder in just a minute. And that image, or that energy from that 40-watt light bulb, is what has to get out into all the cells in your body. That's why you feel. That's why you feel sensations. Now, if you can zoom in on this a little bit, there are actually two different nervous systems in the body. There's the voluntary nervous system, the one that we feel, and then there's the involuntary nervous system, which has a chain of ganglion along the side of it. As a matter of fact, we call this system the automatic or autonomic nervous system. This is unfortunately why some people, when they're injured, when they break their neck, like Christopher Reeves, Superman, broke his neck, this function of the body, the organs, the heart beating, the lungs working, all work automatically. The other way to explain this is, let's take the bladder, for example. There's a red diagram that shows nervous energy coming into the bladder over here in this picture. Is it possible to zoom in any more on this over here? And then there's this blue that comes from the spinal cord as well. Both of these are incorporated. Both of them have to be there. For example, a baby that has a bladder functions, but the bladder fills up with urine, and when the pressure gets high enough, the sphincter opens up and the baby wets their diaper. That's the involuntary nervous system. As you grow older, the voluntary nervous system innervates the valves, and you have sphincter control over the bladder. So this is the two different nervous systems that we have in our body. Now, people often say to me, Doc, how come it bothers me now? And I'm going to take this poster off of here, and I'm going to go to the next poster, the one over here, the one in the office that we affectionately call Heinie-Man. Here is a picture of the nerves in your body on the right side. And as you can see here, let's see up by the neck, if we can move over one more picture. There we go. This is an explanation of all the different nerves. For example, here is the longest nerve in the body. This is called the sciatic nerve. Patients or people are often familiar with this because this nerve is about the size of your little finger. Your legs are obviously the biggest extremity in your body, so they require the largest nerve root. But again, if the brain is the electric light bulb and it produces the energy, the nerve has to flow, or the energy has to flow down the spinal column, out in between the bones by the discs and go to all of the organs. If you put pressure on the spinal cord in one particular spot, it's like stepping on a garden hose. When you put pressure on this particular sciatic nerve, the energy doesn't flow all the way down to the bottom of the foot. This is often why people experience symptoms, pain, numbness, tingling, weakness in the legs, their legs blow out going up steps or things of this nature, because 100% of the nerve energy is not coming down all the way to the lower part of your upper extremity or your foot. Here's a picture of it on the spine. And we want you to, this is what we want you to understand, because this is what happens as time goes by. If we can zoom in on this part of the spine here where my hand is, I'll show you what I'm talking about. This is the picture of a human adult male spine, and as you can see, there's, well, this is the way it works. We break it down. There's 7 sections in the neck. There's 12 sections in the rib cage, and there's 5 sections in the lower back. Inside the spinal column is the spinal cord, and that is what communicates both from your brain out to your body and from your body back to your spine. Here we have an indication of a herniated disc. Everybody's heard of these, this little red thing on the model. People call it a slip disc. There's a bunch of different names for it, but the problem or the indication here is that you put pressure on the nerve root. When you put pressure on the nerve root because this disc is swelling, that's the cause of pain. And this is the cause of discomfort that we see in patients. Now, inevitably, the most common form of trauma that our spine receives are accidents. And the most common form of an accident is a car accident. When people injure the spine, we're going to go to another poster here in just a minute. What happens is, it's like hitting a bad pothole with a car. You hit a pothole and you knock the front end out of alignment, let's say. And then it takes 10 or 15,000 miles and you figure out, well, you look at your tire and you say, well, gee, the tire tread wear pattern is not equal. So here's what we explain to patients, and this is why it's imperative not only that you get an x-ray if you have these type of musculoskeletal systems and have pain, but you need to understand it as well. Here's a curve of the neck taken from the side. This is called a lateral x-ray. Like all mammals, humans have 7 bones in our neck. And these little white rectangles that look like ABC blocks, those are the bones. And in between on an x-ray, we see the black space, and that's the disc. When you're involved in an accident or some type of trauma, your neck usually goes straight. Or there's some other abnormality that we see on the x-ray that indicates that you're pinching nerves. At this stage, this is when you are initially hurt in a car accident, let's say. As time goes by, here is the stage that people most often come in to see us. If you can see this on the x-ray, I don't know if you can zoom in anymore, but as time goes by, 10 or 15 years go on between this x-ray and this x-ray here, thank you. And here you can see a relatively normal disc space between the bones. Here's another normal disc space, but the one above it is worn out. And that closes down the hole where the nerve root comes out, and you get the symptom that we like to call stepping on a garden hose, where the nerve that comes out from the spine no longer can supply 100% of the energy that comes out between the bones at the disc level. Now, we see various versions of this, and the other neat thing is that your body can always heal itself. You take the pressure off the spine, you take the pressure off the nerve, the pain is the last symptom to usually occur, and it's the first one to disappear. And patients inevitably feel, they say, well, I'm out of pain, I don't have any problems anymore, I must be okay. Sometimes that's the case if you're young, but if you're old, in this example that we have here, we have many patients that come into us and they have fused their spine together. And we didn't bring along another model, but basically what happens here is you wear the disc out altogether. The space between the joint fuses together with calcium. And you see this in the lumbar spine, you see this in older people because they have an antalgic lean, they lean forward. So when you wear this space out, the idea is never to do that. The idea is to get it put back in place and then take the proper nutrients to rebuild it. But the idea is when you wear it out, that's when you put pressure on the spinal nerves and on the spinal cord, and that's when you have pain. So the idea here is real simple. There was a number of different sayings, and one of the favorite sayings that we've got is from Thomas Edison. He says, "The doctor of the future will give no prescription or no medication, but will interest his patients in the cause and prevention of disease." Now, let me explain this a little bit more in modern terminology. When somebody comes into us and they've had a car accident 10 or 15 years ago, and they're wearing out the disc, we'll give you an example of one of our recent patients at the office. Her curve in her neck was gone, like we showed you here. It was not only straight, but she had worn out discs as well. And she had just gone to the gym and done something relatively innocuous and wound up in spasm, and she couldn't move. Well, we took an x-ray. We took a couple. And after we took a couple of x-rays, we looked at her neck and we discovered that she had worn out her neck. And this is what we're talking about. For years or for a couple of months or weeks after you have a traumatic event, you have pain. The pain eventually subsides, but the misalignment in the spine stays there, just like hitting a pothole with a car. You knock out the front end, but you don't notice it until 10,000 miles later when the wear pattern on the tire is different. So this lady went in and we told her and we adjusted her and she was better. But then she also noticed on her x-ray, or her physicians did, they took some more x-rays, that her thyroid gland had atrophied and that one side was smaller than the other. Obviously, the first thing they think of is cancer, so they rule all of that out. Where we come from, the way the doctors of chiropractic think, it's very simple. If you cut off the nerve supply, the vital essence to the organs, not only do the muscles malfunction, which is what we feel, but the organs that the nerves supply as well malfunction. Once you turn the nerves back on, the organ gets the energy that it needs and it functions normally. These are simple things, but these are things that people don't understand. Your fingernails grow, your hair grows, the internal lining of your GI tract sloughs off every 3 days like a snake loses its skin. Your body heals itself as long as it has the energy to do so, and as long as all of the other organ functions are working properly. So that's what we try and promote. But the point is, today, when we take a medication, let's say, let me use another car analogy. The idiot light shows up on your dashboard and it says your oil pressure is low. You can take a piece of black electrical tape and put it over that particular light so you don't see it, but you haven't solved the problem. You've removed the symptom. Many times when you take pain medication, when you take aspirin, Advil, Tylenol, whatever you want to take, whatever is prescribed, if the pain persists, that's an indication that your body is saying there's a permanent problem here and that needs to be looked at closer. That's why doctors of chiropractic have a different approach. We don't try and cover up the symptoms. We try and put the body back in place the way the good Lord designed it, and then the body can function the way it's supposed to. Now, the other thing that happens many times is people don't understand this either. The forefathers in our profession years ago understood that doctors of chiropractic, there was a transition from 1895 when chiropractic first started until today, 2015. And in all of these years, let me put it this way. There's another way that this came out today in the news. Doctors, primary healthcare physicians, due to Obamacare or whatever, are becoming scarce. And now they want to use nurses or practical nurses or nurse practitioners, which is great. The more people that communicate, the better off you are. A doctor puts in 20,000 hours in order to learn their profession. That's 4 hours or 4 years of undergrad, 4 years of graduate school, internship, and residency. All doctors do that. Doctors of chiropractic do the same thing. We specialize in x-ray and imaging technology. We do not prescribe medication. In my case, I also have a degree in nutrition, so we try and show you the things that you need in order for your body to heal. The point I'm getting at here is, in today's world, you need primary health care practitioners, and doctors of chiropractic are such. As a matter of fact, if you come into us with symptoms of high blood pressure or diabetes or heart problems, we are not only supposed to diagnose it, but we are obligated to send you to the proper healthcare professional to get it treated. So these things are things that have changed from years ago in the past, and nowadays many of our patients are using us for all of these other things, for ordering blood work and ordering tests. And in today's day and age, St. Joe's has just been bought out by Hershey. This seems to be the acquisition time. Many of the different hospitals, well, all of the ones in town, afford us all the different privileges that we need. We send patients over there. We send them in for tests. They send us back the blood work. The thing that we like is when we communicate and people understand that. In today's day and age, the best thing is that you understand how your body works. And pain, as we were talking about tonight, is an indication. It's your body telling you that there's something wrong, and chronic pain is something that's not supposed to be there. Taking medications to cover it up doesn't deal with the problem. The background problem that still causes the pain is there. Sometimes there are situations where we can't help. The situation is too chronic or too severe, and we refer you on to the proper healthcare professional in order to do that. So with that said, we just want to thank you for listening to us. And if you have any questions, you can get a hold of us at the office. And our number here in the big town of Reading, PA is 610-775-X-Ray. The show here will be replayed on Friday at 2:30 and Monday at 11:30. And it's on the internet on bctv.org, a great website. They electronically keep the videos. They archive them and they stream them so you can go back and look at them for more information anytime you'd like to do so. Thanks again. We enjoyed being with you tonight. See you next month.
Have you been injured on the job? Has your pain lasted for an extended period of time? Have you reported your injury to your company? Have you been examined by a company-authorized doctor? Did they say you were ready to go back to work while you were still in pain? You have certain rights, including visiting other doctors. In many cases, chiropractic care is more effective in relieving pain from back injuries. Call 610-775-X-Ray today and let Shillington Chiropractic Associates put you on the road to recovery.